progress is that less and less people are dying from malaria, and that's the key thing for any disease control. In 2016, we recorded around 1,264 deaths in our health facilities. Last year, we recorded around 308. So it's been a great reduction, and we'll continue to work to make sure that nobody dies from malaria. Admissions, we haven't been doing too well, has been hovering around 340,000 admissions, 390,000 admissions. Last year, we saw a reduction, partly due to COVID, where people were not going to health facilities, and we've seen that reduction across all the other diseases that come to our health facilities. But to confirm that we are doing well, we can look at one of the indicators that we look at. We take children under 5 in the household and test their blood to see if there is malaria parasite in them. In 2011, when we did this, 27% of the children under 5 were positive. They had malaria parasite. And you see the picture, the colors are not the same. We had the northern part being mostly affected, with upper west having 1 in 2 of the children being positive for malaria. Over the years, we have progressed, and you can see that the color is lighter. In 2019, 14% of the children under 5 were positive for malaria parasite, as compared to the 27% that we had previously. So we have made some progress, with Greater Accra being the least affected, and in 2019 we had Western region having the highest level of malaria parasite prevalence. This shows what is happening at our outpatients for malaria. Over the years, we've always had suspected malaria cases of over 10 million. Last year, we recorded 10 million suspected cases, out of which 9.9 were tested, and we confirmed 5.1 million cases and put 4.9 million cases on artemisinin-based combination therapy, which is the first-line drug for malaria. Sometimes there's a gap between. So if you look at the previous years, you see that more people are treated than those confirmed. That gap narrowed over the years, and now we have more people confirmed, and we have a gap between those who are confirmed and those who are treated with ACTs, mostly because they are started with injection artesunate for severe malaria and things. Testing has improved over the years. So we keep saying three T's: test, treat, and track. We've come from an era where malaria was equal to fever, and we are discouraging that. And this figure shows that in our health facilities, we are gaining on that, because 95% of the suspected cases that we saw last year were tested for us to be sure whether it was malaria or not before they were put on treatment. When it comes to the coverage of our interventions, the first one I want to highlight is the insecticide-treated nets. Access measures, if you go to a household and every 2 people need to use a net, how many people in the house will get a net to use? So in 2019, we realized that 67 people of household members have access to nets. That is an improvement of quite a lot over the years. We started from about 30%. But when it comes to sleeping under the net, even though 67% have the nets, we have just about 43% of household members sleeping under the net. So we do have a gap in terms of net use, and that is one of the challenges we are trying to work to resolve, and we hope that the media will help us talk about the need for people to sleep in the nets and how useful the nets are. The picture is not too different from pregnant women and children who are most affected by malaria. You could see that between 2016 and 2019, we haven't had much improvement in the use of insecticide-treated nets among this age group. Malaria vaccine implementation, we're piloting it in a number of selected regions in the country: Volta, Central, part of the Bronga Hafo, and then the Upper East. By the end of December 2020, we had reached 71% of our target having the first dose. This, however, reduces as you go down the doses. And it's something we see with any intervention that you need to get multiple doses, and even worse when it's in the second year of life. That's what we are seeing with the malaria vaccine. We hope that we will be able to get more children to go back for their third and fourth dose. Intermittent preventive treatment also has a similar picture, just like the vaccine, where as you increase the doses, so as you move from IPTP 1 to 2 to 3, 4, and 5, the percentages go down. It's because if the pregnant woman doesn't attend antenatal early enough to start the medication, that pregnant woman is not able to get 5 doses before delivery of the child. The WHO rep mentioned seasonal malaria prevention. That's one thing that we've been able to achieve. The targets that we set ourselves to do over the years. We had targeted to ensure that 80% of the children in the regions that we were working with have access to this life-saving intervention. And over the years, we've always been able to hit the 80%. So in summary, in terms of progress that we made, we have made some progress, in fact, a lot of progress in achieving the target that we set ourselves with our large strategic plan, which ended in 2020. The target was to reduce morbidity and mortality by 75%. For mortality, we achieved it. We reduced the mortality by 89%. We did reduce admissions by 28%. There was an improvement in testing. However, we were not able to achieve our target when it comes to the number of cases that attend the health facilities. And so that's where we have a lot of work to do going forward. And some of the challenges and risks and threats we face is the risk of dwindling donor funds, for which I was very happy when I heard the executive director announce the initiative, and we are going to take him on to make sure that we increase the resources domestically to sustain the fight against malaria. And this other notion where people think malaria has been with us forever and it's not going anywhere, so are we really going to win this fight against malaria? Because of that, they don't put in much effort in adhering to the interventions. And we saw it with the low use of ITNs, even when we have insecticide-treated nets. And this year, we are actually going to distribute nets across the entire country through the mass campaign. So we hope that the noise that we make about the use of mosquito nets, which will be good noise, will enable people to use the nets when they get it. And last year, we saw the fear that people had because of COVID and were not coming to the health facility. Last year was a difficult year for all of us, but under the guidance of the Director General, we did sail through, and we hope that the effect of the competing government funding and then human resources, some of us fell sick because of COVID, and we also had to work more for COVID, so we had a few challenges in the beginning, but this we hope to overcome. We partly overcome and hope to overcome it fully going forward. So going forward, we developed a new strategic plan which spans from 2021 to 2025. And that is what is going to guide the control of malaria for the country. There are 3 main goals of that strategic plan. The first one is to reduce death further, reduce death by 90%. And by 90%, if you look at the death we are recording of 308 last year, 90% of that is taking us to near zero by 2025. We also want to work hard to reduce the cases that we're seeing by 50% by 2025. That means cutting down about 2.5 million cases. That's a very ambitious target. But with all of you on board, with all the work that we are doing and we intend to do, we hope to be able to do that. And take at least 6 districts to pre-elimination to act as a guide or something to galvanize the other districts to follow. How do we intend to do this? So there are a number of things we'll continue doing as we used to do. We just have to intensify it. Routine distribution of insecticide through antenatal clinics, through child welfare clinics, and through schools will occur across the entire country. This table on the right, it's on